Welcome, everyone, to our show, Coffee with Chris. Today, we have a great topic we're going to be discussing, and it is called How to Convince a Senior to Wear Adult Diapers, right? And this is a lot of our family members, they can possibly have incontinence, and this is a condition that's often difficult for a person to accept and deal with. So, welcome to our show, Coffee with Chris. We're going to have a great discussion today.
Welcome to our show, Coffee with Chris. Our mission is to provide you with home care tips, education, and resources to ensure you receive the quality care you deserve in the comfort of your home.
So, hello, everyone. Welcome to our show. I wanted to talk to you today about a topic that I come across all the time, and you might not, but you will. I promise you, maybe possibly as your parents are getting older, that this type of issues come about, and it's good to approach it in a very respectful way. Incontinence, again, is a condition that's, it's often difficult for a person to accept and deal with. Many seniors try to ignore this new development and carry on with their lives, right? But a head in the sand approach usually draws more, attention to the problem. There are always ways you can, encourage a loved one to address this type of issue. And that's what we're going to be discussing today a little bit. And so, but they truly during these times do require patience and understanding and having a commitment of upholding, making sure that you uphold your parents' dignity. The most common phrase that I always hear is that my parent won't wear adult diapers and it drives me nuts. And this is a common complaint from family members and other caregivers too, whose loved ones are suffering from incontinence. And, I truly do sympathize for them. However, one glaring piece of this sentence stands out to me really is the word diaper. Figuring out how to talk to your parents about incontinence is going to be very difficult. If you're experiencing it now, it is. The first thing I urge, caregivers and family members to do when tackling this very sensitive topic is to think carefully about the word choices that you are giving out. Seniors often rebel against the word diaper. As an adult of any age, would. So this term typically is associated with, babies or toddlers who have yet to be toilet trained. What adult really would take this word, in a kind way, and especially when it's applied, to them. So figuring out how to talk to your parents, right? Take one step further in this type of situation. Think about this. If you're a middle-aged woman who has had children, you've probably suffered from the stress, incontinence occasionally, meaning that, you've had leaked little urine if you're coughing or sneezing or laughing, right? Or perhaps you even used a panty protector just in case, right? So, how would you feel if your husband or friend referred to, your protection as a diaper? Just an example, So just trying to bring it to light here. But the bottom line is diapers are for babies. No adult, regardless of their level of physical or mental disability, should be treated as if they were a baby, right? So aging and age-related conditions, are already rob our loved ones of much of their independence and dignity already, right? So our word choices and tone of voice may not seem to be important, but communicating and providing care in ways that help our loved ones feel dignified is a true game changer. especially when it comes to promoting cooperation, and you have to be boosting self-esteem for them. This may seem like, nitpicky, but please refer to the incontinence products with age appropriate terms. Like think along the lines of the word briefs or pads, underpants, pull-ups, the actual brand name that we see at the stores. It's called Depends, for example. Anything that you want, just make the word respectful, and you'll have mastered the first step towards getting your parents to wear incontinence wear. I ask you to do this not only for your parents, but for yourself too. Using respectful words will help remind you that you are caring for an adult who deserves to be treated such as, right? So, I'm aware that just changing the words you use isn't going to completely solve the problem. It's not. When incontinence becomes even an occasional issue, it's important for your loved one to see their doctor about it. It may be caused by something straightforward like a urinary tract infection, or an OAB, which is an overactive bladder. A more serious underlying type of issue like prostate problems in men, or pelvic prolapse in women, formerly called POP. Most likely you've taken your parent to the doctor, usually to address this issue, right? So, after testing, you determine the type of incontinence your loved one is experiencing. Typically their doctor is able to just recommend maybe some type of, pelvic floor exercises, or, there are some minor surgical procedures and even medications that they could recommend to you. But sometimes, a second opinion from a urologist is really going to be a really good idea, for yourself. So let's talk about, if your loved one is still cognitively sound, right? But they simply prefer to live in denial about this new development in their health status. Okay. Try appealing to their sense of, vanity. After all, vanity is what keeps us, in denial about many age-related type of issues that, our parents are going to go through. Our culture is guilty of ageism to the extent that many people go to extremes to appear as if they are winning this losing battle against time, right? Certainly, incontinence is very difficult to accept at any age. However, if you or a third party can convince your parents that it's much more embarrassing to smell like urine than it is to wear proper protection, you may possibly get somewhere with your parents right there by just discussing and pointing out that one tip. Promise to work with them, and make them feel comfortable. Incontinence frequently causes seniors to withdraw and become like a little bit less active, so they can avoid embarrassing type of situations. But remember, it doesn't have to be this way. It doesn't. Just like many of the other issues, of our parents that they're gonna have, incontinence may be a better approach by maybe a non-family member. Think about that. Maybe it's coming in from you. You're just not getting anywhere. So such as a friend or a doctor are really good recommendations I would give. Well, why? Right? Because, your parents tend to discredit or shrug off the observations, suggestions by your own family member, especially when, it's coming from, an adult child. So, as our parents are aging and parents are changing, from diapers when we were babies, right? We were very aware of this conversation, so it's difficult for them to really grasp the fact that, Mother Nature has pulled this cruel switch on them, right? They feel like receiving advice and directions of how to really cope for someone you raised who has not firsthand experience with this issue is often, it's often just too much to handle. So they react and they behave in a specific way by getting dismissive, or they will be defensive. It may be less embarrassing to have these discussions possibly with a doctor being involved who's seen all this, or maybe a friend who's like dealing with these challenges as well too. And when their defenses typically are down, they usually have more. They're more willing to listen. So why seniors refuse to wear underwear, incontinence underwear. There are plenty of reasons. Besides denial and embarrassment that can make it difficult, to get an elderly person to wear adult briefs. Some of these factors are out of their control. It's out of their control, and it could take a great deal of patience on behalf of you as the child to work through this. So diminished senses of sight and smell, typically what you're gonna, can happen. Our senses typically weaken naturally, and as we age, we can usually result in seniors' lack of awareness of how smelly and the soiled clothes that they have, and the furniture that's getting urine on it, and it's smelling up the house. If they have not acknowledged that the fact that their accident made, and they possibly will downplay it and continue to wearing the same clothing all the time and getting it wet and it's dry, and then when it desperately needs to be laundered, need to put it in the laundry, because they don't realize the full impact of incontinence has on their personal presentation. They need to be aware of it. They may feel that incontinence protection is unnecessary, but especially when you bring up these type of scenarios, and when visitors are coming over, they might have a different outlook on this. It's a difficult subject to approach, but informing a loved one, I'm telling you that that their body odor or smell in their home, has become an issue, and become offensive is sometimes the ticket really of the compliance with incontinence, and talking to them about having these conversations. Our parents they would be truly embarrassed when they realize that they have caught onto this issue that they had been successful covering up for such a long time, right? But just be sure to, when you're going to talk to your parents about it, you got to be gentle. And again, you have to be respectful too about it. The depression could be a contributing factor as well too. That's something that happens with our parents as they age in place. But if your loved one feels no embarrassment or concern over the smell or the appearance, then you might have more serious underlying issues going on right now, on your hands. But unfortunately, loss of interest in personal care, socialization, and other activities really are the symptoms of depression when you start seeing that with your parents. Spotting depression in seniors can be a little tricky, but social isolation, chronic health conditions, and pain put this type of, put us all in a bucket, right? At a significantly, really, they're at a high risk. At the very least, depression screening should be part of your loved one's annual visit as they are aging and having the good relationship with their primary care physician. If you notice that the symptoms between visits, it's important to make an appointment as soon as possible when you start to see these symptoms. And treating depression may help your loved one feel a little bit better and spur them to kind of engage in more of their personal care and their hygiene. In return, can boost possibly their self-esteem as well too, and encourage them to take a venture and get out and be more social. It's part of our integrated wellness. Dementia might be the culprit as well too. They are starting to develop dementia. If in denial, obliviousness and depression aren't factors in your loved ones, refusal or to partake in incontinence care, a dementia screening might be really the next step that you have to take with them. It doesn't matter who tries to, reason with them, reason with them or how to go about it. If cognitive decline starts to occur, and it is a factor, a senior may no longer be capable. Your parents may not be capable of making, sound decisions, and especially wearing incontinence products, and discussing these things, changing their clothes, and all their self-care type of tasks. A doctor appointment has got to be something that you have to put in this list of tips that I give you here, a full evaluation and finding out, what stage they are in their dementia and what signs and symptoms are starting to appear. So early diagnosis is crucial for your adequate planning and care. So, I'm aware that, there are times when none of the above tips work. Okay. Right. For well-meaning family caregivers, children out there, caregivers working for a home care company, our elderlies are in charge of their lives and their daily choices, especially when there's no cognitive issues going on. While our gentle suggestions they have to come from a good place and be respectful about it. There's little we can do sometimes about this issue, while there are still competent ways of how to approach it to make and let them make their own decisions, to make them feel that they're going to make a good choice. You could let them know, do what you can, do what you want, but this is something that you have to treat lightly. And again, with respect, and give them dignity. And sometimes you just have to then just let go and see what happens. Let them resonate on these topics. Time may take, care of these things. If you push too hard, if you push too hard, it might go in the opposite direction. So, sometimes when we leave people alone and have them work out their own problems, they stop kind of resisting, and then they take this, issue that they have, like head on. They just have to soak it all in. So I hope this helps everyone. And if you have any comments or questions or anything about this, you know how to reach out to me. I'm Chris Zaid from Affinity Senior Care, and you can always contact me on all social media platforms. Send me a message, call my office if you need to, and discuss it. And if you need me to come talk and you want to come talk to your family, in your living room, in your family room, wherever it is, at a facility, I want to help you out and make sure that, we can have a positive result. And sometimes it does come, it resonates when it's a different person and it's not you. Thank you for listening to our show, Coffee with Chris. Take care, and hope everyone has a great day.
Welcome to our show, Coffee with Chris. Our mission is to provide you with home care tips, education, and resources to ensure you receive the quality care you deserve in the comfort of your home.